So now we're going to discuss in detail about the retinaculum. What is attachment, structures passing above the retinaculum, below the retinaculum. Yes, we're going to discuss in detail. Now, flexor retinaculum, also known as transverse carpal ligament, also known as transverse carpal ligament. That means the retinaculum attaching to carpal bones. So first we're going to discuss some basic points about the carpal bones and then we go to retinaculum. Okay, right. So carpal bones, totally 8 in number. They're arranged in 2 rows, proximal row and the distal row. Okay, right. Now again we have a mnemonic. Now this is lateral side say, this is medial side say. So proximally, she looks too pretty, and distally, try to catch her. Very old mnemonic, and still we are using the same mnemonic only. This is proximal row and this is distal row. So the proximal row, we have 4 bones. So mnemonic, she looks too pretty, try to catch her. So what is S? S is scaphoid laterally, and then lunate, T trichotrum, and P pisiform. Okay. Now in the distal row, we have trapezium, trapezoid, capitate, and hamate. Okay. So proximal row, scaphoid, lunate, trichotrum, pisiform. In the distal row, trapezium, trapezoid, capitate, and hamate. Arrangement from lateral to medial. Okay. Now we're going to discuss some basic points about these carpal bones. So scaphoid, lunate, and trichotrum articulate with the lower end of radius to form wrist joint. So scaphoid, lunate, trichotrum. So these 3 bones articulate with the lower end of radius to form the wrist joint. Articulate with the lower end of radius bone to form wrist joint. So wrist joint is formed by 4 bones. Proximally, we have lower end of radius. Okay. Distally, we have scaphoid, lunate, and trichotrum. Now the point is, ulnar bone involved in wrist joint formation or not? No. Ulnar bone is not involved in wrist joint formation. Ulna, it is not involved in wrist joint formation. Okay, right. Now we're going to discuss some more points about these carpal bones. Now among the carpal bones, fracture is most commonly seen in scaphoid. So please write most commonly fractured carpal bone. Most commonly fractured carpal bone, our scaphoid. Okay, right. So in the case of fractured scaphoid, the patient have pain or tenderness in the anatomical snub box. I told you in the discussion of snub box topic. Okay, so in the case of fractured scaphoid, the patient have pain or tenderness, in the snuff box. Okay, right. Next point, dislocation is most commonly seen in which bone? Lunate. Dislocation is most commonly seen in lunate. Fracture scaphoid, dislocation lunate. Right. Next, largest carpal bone, and first carpal bone to ossify. Okay, our capitate. Okay, next, smallest carpal bone and last carpal bone to ossify, and that is also a sesamoid bone. So smallest, last carpal bone to ossify, last to ossify, and that is also a sesamoid bone. That is also the sesamoid bone. That is our pisiform. So for pisiform, we have 3 points. smallest carpal bone, last carpal bone to ossify, and it is sesamoid bone. I hope you know the meaning for the word sesamoid bone. Sesamoid bone means that is a bone formed in tendons. Bone formed in tendons. So pisiform bone, it is the sesamoid bone formed in the tendon of flexor carpi ulnaris. This is important. They will ask you. So pisiform, yes, sesamoid bone formed in the tendon of flexor carpi ulnaris. So fracture is most commonly seen in scaphoid, dislocation, lunate, largest carpal bone, first carpal bone to ossify. They gave this question in the AIMS exam, but very old question, 2017 November AIMS, they gave this question, right? Now smallest carpal bone, last carpal bone to ossify, sesamoid bone, pisiform, okay? So these are the basic points about the carpal bones. So you have to identify these bones in the image. So in the exams, they will give image based question only. They will mark any of these carpal bones and they ask you to identify the carpal bones, okay? Now this is the lateral side and this is medial side. Now we're going to zoom this area. So again, this is lateral, this is medial, and this is our lower end of radius bone, and this is your ulna bone, lower end, and this is the proximal row of the carpal bones, and this is a distal row, okay? So the proximal row, we have scaphoid, lunate, triquetrum, pisiform. Distal row, trapezium, trapezoid, capitate, and hamate. Okay, right. So now to these carpal bones, yes, our retinaculum band is attached. So that's all about the carpal bones. Now we're going to discuss about the flexor retinaculum. Now this band is also known as transverse carpal ligament. So retinaculum attaching to carpal bones, right? Now we draw one line diagram. Now we're going to draw the carpal bones. So we are assuming this is lateral side and this is medial side, okay? So laterally, the flexor retinaculum attaching to tubercle of the scaphoid bone and crust of trapezium in the distal row, proximal row, scaphoid, tubercle, distal row, crust of trapezium, medially to the pisiform bone and hook of the hamate. Okay, this is attachment of flexor retinaculum, the tubercle of scaphoid, crust of trapezium laterally, medially to pisiform bone and the hook of hamate. So now we're going to draw the retinaculum. So this is our flexor retinaculum, also called as transverse carpal ligament, right? So now we know the attachment. So now we're going to discuss the structures passing above this ligament and below this ligament. Okay, so mainly the forearm tendons only. So forearm tendons, they enter the palm by passing above or below this ligament. So we're going to list out the tendons in the forearm and we're going to write one by one. Okay, so what are the tendons in the flexor compartment of forearm? In the superficial group, we have pronator teres. So by the side you can write. In the superficial group, we have pronator teres muscle, and then flexor carpi radialis, palmaris longus, flexor carpi ulnaris, flexor digitorum superficialis in the superficial group. In the distal group, flexor digitorum profundus, flexor pollicis longus, and pronator quadratus. So these are the muscles in the flexor compartment of forearm. Now what are the tendons passing above and below? So before that, our pronator teres and quadratus, they are not passing either above or below the ligament. Why? Because they are involved in which movement? They are involved in pronation movement. I told you already, pronation, supination, it is the movement of radius bone over the stationary ulna. So these muscles, they have attachment only to radius bone, ulna bone. So they don't come to palm region. So they don't pass either above or below the ligament. Okay. What about our flexor carpi radialis? See, flexor carpi radialis, which is not passing above or below, it is passing between the slips of retinaculum. Laterally, the retinaculum ligament will split, and between the two slips of the retinaculum, our flexor carpi radialis will pass. This is our flexor carpi radialis. So the point is, flexor carpi radialis tendon, which is passing between the slips of flexor retinaculum. That is the point. Okay, right. Next, palmaris longus. So palmaris longus, it is passing above the ligament. So this one over. Again, flexor carpi ulnaris. Again, it is not passing either above or below, because the flexor carpi ulnaris, just now I told you, the tendon of flexor carpi ulnaris, one sesamoid bone is formed. That is our pisiform bone. So again, flexor carpi ulnaris also not passing either above or below. Next, this FDS, FDP and flexor pollicis longus, they pass below the ligament. Okay, so superficially you have FDS and the deep layer flexor digitorum profundus. So this is our FDS and this is FDP. Now FDS and FDP, they have a common synovial sheath. Okay, and that synovial sheath is called ulnar bursa. We have a synovial sheath for FDS and FDP. So this one. So the synovial sheath is called ulnar bursa. Okay, so please write, what is ulnar bursa? Ulnar bursa is the synovial sheath. It is the synovial sheath for FDS and FDP, a common synovial sheath for FDS and FDP. Okay, right. Next, flexor pollicis longus. Flexor pollicis longus is here, and the flexor pollicis longus is having a separate synovial sheath. Okay, and that is our radial bursa. That is radial bursa. So radial bursa is a synovial sheath for flexor pollicis longus. Synovial sheath for flexor pollicis longus. Now between radial bursa and the ulnar bursa, below the ligament, one nerve is passing. That is our median nerve. So I am writing only MN here. So MN is nothing but our median nerve. So median nerve is passing below the ligament between radial bursa and the ulnar bursa. So now in the case of the synovial sheath inflammation, right, now median nerve compressed. And that condition is called carpal tunnel syndrome. We write later. Okay. So the point is, the median nerve is passing between the two bursa. Now these are all the structures passing below the ligament. So below the ligament, we have FDS tendon, FDP tendon, and their synovial sheath, ulnar bursa, flexor pollicis longus tendon, synovial sheath, radial bursa, and median nerve. Okay, right. So now above the retinaculum, on the medial side, we have one ligament. Now we know the name of the ligament. I told you in the ulnar nerve topic, that is our volar carpal ligament. That is our flexor carpal ligament or volar carpal ligament. Now because of this ligament, we have one canal here. That canal is called Guyon's canal. That is our Guyon's canal. So the structures passing through the Guyon's canal, your ulnar nerve and ulnar artery. So ulnar nerve and ulnar artery passing here. Okay. So ulnar nerve and ulnar artery, they are passing above the ligament in Guyon's canal. We have three more structures passing above the ligament. Now one artery on the lateral side and two cutaneous nerves, this one and this one. So I'm going to mark, this is 1, this is 2 and this is 3. We write the names below. So one is superficial palmar branch of radial artery. Superficial palmar branch of radial artery. Okay. Number 2, palmar branch of median nerve. Okay. Number 3, palmar branch of ulnar nerve. Palmar branch of ulnar nerve. Okay. So these are structures passing above the ligament. So what are those? Ulnar nerve and ulnar artery in the Guyon's canal. superficial palmar branch of radial artery, palmar branch of median nerve, palmar branch of ulnar nerve, and palmaris longus tendon. Okay. Now between the slips of retinaculum, yes, flexor carpi, radialis tendon will pass. So these are the various structures passing above and below the ligament. Okay. Right. Now this diagram. Now in this diagram, yes, we are seeing the volar carpal ligament. So below the ligament, yes, we have a Guyon's canal and ulnar artery and ulnar nerve. They are passing through Guyon's canal. Fine. Right. So now we're going to discuss one applied, that is our carpal tunnel syndrome. Carpal tunnel syndrome. So carpal tunnel syndrome is nothing but the compression of median nerve. Compression of median nerve while passing below the flexor retinaculum. Okay, right. Now features of carpal tunnel syndrome already we discussed in the median nerve topic. Now we're going to do one simple test, Phalen's test, to diagnose our carpal tunnel syndrome. So in the Phalen's test, we are asking the patient to do wrist flexion in the inverted position like this. So patient is having carpal tunnel syndrome. Already median nerve is compressed. Now by doing this, again we are reducing the space for the median nerve. So within few seconds, the patient have a tingling sensation. The patient is having carpal tunnel syndrome. Now within few seconds, the patient develop a tingling sensation or numbness in the area supplied by median nerve, that is over lateral 3.5 digits. Okay, so this is our Phalen's test. So in the case of carpal tunnel syndrome, immediately within few seconds, the patient develop numbness or tingling sensation over the lateral 3.5 digits. So that's all about this topic. Okay, so this topic again, so many details are there. So don't simply mug up the structures passing above or below the ligament. Okay, so first know about the carpal bones, and then draw the carpal bones, draw the ligament, list out the forearm tendons. Okay, and then write them above or below, and then complete the diagram. So very important topic. Yes, that's all about the flexor retinaculum.